Good afternoon, and thank you for joining us today. I'll start with the usual update on today's statistics. The total number of positive cases reported yesterday was 682. That represents 3.4% of the total number of tests and takes the total number of confirmed cases in Scotland to 208,429. 276 of those new cases were in Greater Glasgow and Clyde, 116 in Lanarkshire, and 102 in Lothian. The remaining cases were spread across the 8 other mainland health board areas. 512 people are currently in hospital. That is 13 fewer than yesterday. 38 people are in intensive care, a reduction of 2 from yesterday. But I'm very sorry to report that 17 additional deaths have been registered in the last 24 hours of a patient who first tested positive over the previous 28 days. That takes the number of deaths registered under this daily measurement to 7,500. However, we know from the latest National Records of Scotland data that the total number of deaths is now well over 9,000. Around 2 weeks ago, we saw the anniversary of the first case of COVID-19 in Scotland. Today, we recognise a harder anniversary, the first confirmed loss of life in Scotland to this virus. In every corner of our nation, this pandemic has brought grief and heartache over the last year. We've been discussing with different organisations and communities how we can commemorate those who have lost their lives. As part of that, we intend to hold a national minute silence on the 23rd of March, the anniversary of lockdown, and we will set out further remembrance plans shortly. For now, I want to take this opportunity once again to send my deepest condolences to all who have lost a loved one to this dreadful illness. As you can see, today I'm joined by the National Clinical Director, Professor Jason Leitch, who will help me answer questions shortly. Before that, though, there are 2 main issues I want to focus on. The first is about the progress of our vaccination programme. As of 8:30 this morning, 1,844,636 people have received the first dose of the vaccine. That's an increase of 18,836 since yesterday. In addition, 149,409 people have received their second dose of the vaccine, which brings the total number of second doses to 7, which is an increase on yesterday of 7,976. 97% of 65-year-olds have now received a first dose of the vaccine, so have 46% of 60 to 64-year-olds, 38% of 50 to 59-year-olds, and 31% of 50 to 54-year-olds. As you know, our daily vaccination rates have been affected by a dip in supply over the last couple of weeks. However, we now expect that over the next 2 weeks, vaccination levels will significantly increase. This is, as always, subject to supply, but our expectation is that in the next week, we will deliver in the region of 400,000 doses, that's first and second doses combined. And we fully expect to be able to offer first doses to the remaining priority groups by mid-April. Based on the most recent advice from the JCVI, we have agreed that these priority groups will include rough sleepers, people in emergency accommodation, and people in supported accommodation. They will be vaccinated alongside priority group 6 in the programme. There are 3 other points I want to highlight in relation to vaccinations. The first is about improvements in the way in which we report vaccine uptake. At the moment, Public Health Scotland publishes a daily breakdown of first and second doses by age group, and the Scottish Government publishes first dose figures for the other JCVI priority groups, such as health and social care workers and care home residents. From today, Public Health Scotland will start to publish full first and second doses for all of the JCVI groups. and they will provide a more detailed breakdown of the numbers of people in each group who have been vaccinated. For example, they are introducing a new measure to report on vaccinations for health and social care workers. This measure is more precise since it is based on specific job categories. It therefore allows Public Health Scotland to calculate more reliably the proportion of frontline health and care workers who've received the vaccine. Public Health Scotland will also now publish a monthly update on the population of care homes for older people. This is important because new residents are constantly coming into our care homes. So these updates will allow Public Health Scotland to publish more precise information of the proportion of current residents who have had their first and second dose. And of course, all of that information is publicly available, and it allows you to see for yourselves how much progress we're making. The second point I want to highlight is important, and it's for unpaid carers. For the purposes of vaccinations, many unpaid carers have already been identified through GP records or the social security system. And by now, most of those carers will have received their appointment letters. But not everyone who is eligible will have been identified in this way. So from 8 a.m. on Monday, that's Monday the 15th, we're launching a new service which will allow unpaid carers to register themselves for vaccinations. You're eligible if you're aged between 16 and 64 and provide regular face-to-face care for a family member or friend who may have a disability, physical or mental ill health, a developmental condition, frailty, or substance misuse. The service can be accessed at NHS Inform/carer register. If you can't get online, you can also phone the vaccination helpline on 0800 030 80130. That's 0800 030 8013. When you register, you'll be asked for some personal details, such as your name, your address, your date of birth. This allows us to cross-check whether you're eligible and whether you're already on our system. It's possible that your letter is already on its way to you. You'll also be asked for your contact preference, and you'll then be contacted with details of your appointment, which is likely to be scheduled the following week. So if you're an unpaid carer and you haven't yet received an appointment, please register with the new service. The care that you provide, as well as being hugely appreciated, is also very important. And so it's vital that you get the vaccination and the protection it provides as soon as possible. Finally, on vaccinations, I want to draw your attention to a major study which has been published today by Public Health Scotland and the University of Glasgow. It focuses on the impact of vaccination on NHS-employed healthcare workers and members of their households. That's more than 300,000 people in total. The study finds that vaccinated healthcare workers have a reduced risk of infection and hospitalisation compared to workers who've not had the vaccine. And it shows that the risk of infection amongst their household members is also reduced. In fact, it is around 30% lower than in households where the healthcare worker had not been vaccinated. It's obviously very encouraging data indeed. We've already seen the impact the vaccination programme is having on deaths in care homes and increasingly in the community. Today's study adds to the growing evidence that vaccination can also help reduce the transmission of the virus. The success of the vaccination programme is, of course, a key factor in allowing us to ease restrictions. And that brings me to the other key issue I want to cover today. As you know, we announced on Tuesday a number of changes to the restrictions on outdoor meetings and activities. They come into effect from today. As a result, in areas across Scotland, a maximum of 4 adults from 2 households can now meet outdoors. This can be for social and recreational purposes as well as essential exercise. You can meet in any outdoor space, including private gardens. However, 2-metre distancing should continue to be observed at all times. and you should only go indoors if it is essential, for example, in order to reach the back garden or to use the toilet. In addition, you still do need to comply with travel restrictions, and so for now you should continue to stay as close to home as possible. For 12 to 17-year-olds, outdoor meetings are also limited to a maximum of 4 people, but the 2 household rules don't apply. So 4 12 to 17-year-olds from 4 different families will now be able to get together outdoors. We hope this makes it a bit easier for young people to meet up with their friends. The rules on organised outdoor activity also changes from today. For adults and young people aged 12 to 17, outdoor non-contact sports and organised group exercises are now permitted in groups of up to 15 people. And Professor Leitch will say a bit more of that shortly. All of these changes are focused on enhancing people's well-being, and together they represent gradual but important steps towards greater normality. As you know, Monday will also see the return of more pupils to schools. And in the First Minister's statement this coming Tuesday, she will say more about how we will seek to ease other restrictions in the coming weeks. But the key point is that all of this is only possible if we continue to suppress the virus. So for the moment, please continue to follow the rules. Notwithstanding today's changes, the most important rule of all is to stay at home right now. Outdoors, only a maximum of 4 from a maximum of 2 households. And if on any occasion when you do leave the house, please remember facts. Wear face coverings when you're outside and doing essential shopping. Avoid anywhere that is busy. Clean hands and hard surfaces. Use 2-metre distancing if you're talking to someone from another household. And self-isolate and book a test if you have symptoms. By following all of these rules, we can help to keep ourselves and our loved ones safe. And we can help to keep the virus under control while vaccination continues. So please, stay at home, protect the NHS and save lives. And thank you once again to everyone who is doing that. Let me go now to Jason.
Thanks, Cabinet Secretary. So just a brief extra information about the activity and sport relaxations starting today. So those living in level 4 areas, which is all of the Scottish mainland, aged 12 and over, will now be able to take part in organised non-contact group sport and physical activity outdoors in groups of up to 15, including up to 2 coaches. And those under 12 can also resume organised outdoor contact sport. And I know that will come as a great relief both to the under 12s and to those who look after them. We've also provided some flexibility around the travel restrictions so that under 18s can also travel across local authority boundaries to attend their local club if it is nearby. That is not to allow large travel, but just if it's just across the local authority boundary. We know how important these activities are to children and young people, both for their physical and mental health, and how much they've been missing them. That's why we've continued to try to prioritise under 18 sport and activity throughout this pandemic. We also know that sport and physical activity providers have been operating under very robust guidance with trained COVID officers, which provides the Scottish Government with high levels of confidence. And I hope it provides young people and their parents and carers with the assurance they need to re-engage with sport and activity in their local communities. Sport Scotland's website has been updated with new guidance, and I know that sporting bodies, including the SFA, have also just updated their guidance and will be contacting club members just as quick as they can. Thank you.
Thanks very much. Thank you, Jason. Let's go now to our journalists who've joined us today. And first is Kirsty Clark from STV.
Good afternoon, and thank you, Health Secretary. Now, with those easing of the lockdown restrictions today and the schools going back for more pupils on Monday, is next week too early to be looking at further easing when we just don't know what sort of impact those moves are going to have on transmission? And to Professor Leitch, if you don't mind, there are concerns around the Old Firm derby in next week, considering the events that we saw last weekend and the breaking of those lockdown restrictions. What assurances are you going to be looking for that Old Firm game can go ahead safely and when is that decision likely to be made?
Thanks very much, Kirsty. On your first question, and I'm sure Jason may want to add to what I'm about to say. Remember that what we are trying to do, and I'm assuming you're referring to the statement that the First Minister will make on Tuesday, where she looks further ahead and talks about the framework. So what we're doing now is we're taking cautious, gradual and evidence-driven steps out of, to ease the restrictions and currently in lockdown, slowly, step by step, with really importantly, 3 weeks between the periods so that we can look properly at all the evidence that gives us to tell us how we're doing in suppressing the virus, how the vaccination programme is going, bringing in other data like the data I spoke about earlier from Glasgow University and Public Health Scotland to inform the clinical advice that we receive from Jason, the CMO and others, so that we can then in Cabinet make the judgments that we need to make about what more we can do. And we've always said that one of our major priorities is to get children and young people back into school, back to closer to normal face-to-face learning. So you're right in as much as we need to be cautious, we need to take gradual steps, and we need to take time to ensure that the data that we're looking at, it gives us a justification for moving forward. But what the First Minister will do on Tuesday, as she said some time ago she would do, is set out how we believe we are doing so far and what the easings have done so far, what the indicative dates are as we look ahead, and importantly, how we will make decisions when we get to the point, we hope, where we come out of level 4 into other levels, and what will be the factors that will allow us to make those decisions about further easings. So there won't be absolute dates, there will be indicative dates, there will be what we call gateway moments where we say, as we did in the week that's just passed, that the easing that we wanted to see from Monday for schools, there would be a final decision on the 11th of March to confirm whether we could go ahead or whether we couldn't. Those checkpoints along the way, if you like, are really important. And I know it can be frustrating for people because we all want to know when can I do whatever matters to us. And businesses want to know when can we open, when are we planning for. We understand all of that. But we need to take the steps and the process that I've set out and the First Minister will say more about on Tuesday, because I guess the bottom line is none of us want to go back into lockdown. We want to come out of where we are now in a way that is sustainable and means that we don't have to move back. And that's why it is frustratingly, I understand, at times cautious, but it is, I think, the right approach. Jason.
So on that one, and then a little bit on the Old Firm game. So just to underline some of the data that will help inform that. So up until Monday, and that's where we leave a 3-day gap in order for the data to catch up, and that's what we use for our 7-day average. So up until Monday, everything was looking good. Numbers were falling, we were decelerating. Our 7-day average across the nation was 65 per 100,000, the lowest it's been for months. And about half of the local authorities in Scotland were under 50, the point at which the WHO say you are beginning to have control, but not complete control. You need to be under 20. But since Monday, the numbers have risen. So Tuesday, Wednesday, Thursday, Friday, the numbers have gone up. And that has worried us again. They haven't gone up dramatically, and it may just be a blip, but we don't know. And that reinforces the fact that we should do two things. We should open slowly, and we should have 3-week checkpoints, just as the Cabinet Secretary has intimated. And that's exactly what we did with schools, and that will continue to be our advice. Anything that we say about beyond 3 weeks will have to be indicative. It will have to be our best judgment for that next phase, and we have to have a reverse gear. because if those numbers continue to rise from today to tomorrow to this time next week, then we will have to rethink it. I'm very hopeful they will continue to go down, but that depends on each and every one of us. That leads neatly to your second question. Let me be very clear. It's not my job to decide what reassurances we should seek from the football authorities or from the clubs. I'm a public health advisor. I will join Mr Youssef today in a meeting with the clubs and the football authorities, and I will provide public health advice. That public health advice is not complicated. It will be that everybody involved in this coalition should be as strong as they can around that guidance. That involves the Scottish Government, us telling people what that guidance should be. It involves the football authorities being very clear. It involves the clubs being very clear. And finally, it involves every single fan being clear about what they should do and following that guidance. That reassurance from each of those bodies, but principally from the individuals, from the football fans, of which I am one, to follow the guidance, to stay at home, to celebrate at home and digitally, and then in the future, look forward to being able to celebrate again in a more conventional way.
Thanks very much, Jason. Aileen Clark from BBC. Aileen, are you there?
Can you hear me now, Cabinet Secretary?
I can hear you now, Aileen. Hello.
Lovely. Apologies about that. Just following on from that, I mean, how cautious, though, do you think you really have to be? Because when you think, as you say there, you know, these figures this week could just be a blip. The data last week was very good. This study that you referenced there, Cabinet Secretary, about the how vaccines are actually now stopping the spread. You've now got data on that, which wasn't there before. I mean, do you think we could potentially still be on course for easing some of these restrictions earlier than flagged? I mean, there seems to be a lot of good indicators there. It still seems to be, in general terms, going in the right direction. And they're opening hairdressers in Wales on Monday. Thanks
very much, Aileen. How tempting it is for me to say that we would do something similar. As undoubtedly viewers can see, I am certainly missing the hairdresser. But how cautious do we need to be? We need to be as cautious as we think is necessary to ensure that when we take steps forward, we don't need to take steps back. You know, I can think of nothing worse for people watching than to begin to come out of the current serious restrictions that we're under, to do that too quickly because we're impatient to be out of that, only to have to go into that reverse gear. That is not where we want to be. So the data and the indicators are promising, but at the same time, you've just heard Jason talk about what the numbers have done in the last few days. So we're by no means on an absolutely steady, sustained, progressive downward trajectory. We're not there yet. The vaccination programme is doing well, but we've got to get to mid-April to have vaccinated all of those priority groups 1 to 9, to have offered everyone a vaccination in those groups, and then move to the rest of the adult population. Now, getting to mid-April and achieving that, if supplies allow, is a significant milestone because JCVI pulled out those priority groups deliberately to reduce both morbidity and mortality. So focusing hard on those most at risk of serious illness and death. So getting to a point where we've offered everyone in those groups 1 to 9 a vaccination by the middle of April is a significant point. But at the same time, it's not the silver bullet. Everything else needs to be going hand in hand. Our test and protect system needs to be working well, and it is. But most importantly, all of us need to continue to comply with the guidance so that we keep bringing cases down steadily with no blips one way or the other, but steadily downwards. Remembering that every time we ease restrictions, even by a little, then the case numbers can rise. Every time we say more people can meet together, the case numbers can rise. That's why what is happening today is the minimum we think we can do to allow people to be together a bit more and give our young people a bit more back to the life they want to live with their friends, undertaking sport. But it's all outdoors. So it's in the place where the risk itself is less than indoors. So I would hope that we can move quicker, but we are not going to move quicker in order to be popular. We're going to make the right decisions, because that's our responsibility, to make the right decisions to take us all safely out of where we are just now in a way that, to the best of our ability, we judge means that we won't have to take a step backwards. Jason.
Only very quickly. I agree with you, Aileen, about the medium-term data. I disagree with you about the short-term data. So the medium-term data is good, encouraging, and continues to show improvement. The short-term data does not. The last 4 days have been increases. We've got 700 cases today, 250 cases in Greater Glasgow and Clyde, and over 100 cases in Lanarkshire. If they translate into 70 admissions and 7 deaths, which is the traditional numbers we've had, that's not good news. That's going in the wrong direction. However, vaccination is beginning to help us with that. So it will reduce hospitalisation and reduce death. But just as the vaccination is going well, 40% of the population vaccinated, second of medium-sized countries in the world, the second highest percentage of any country in the world, 60% remain unprotected. And until we protect many, many more people, we need to follow the guidance. So that's why we need to be so careful.
Thanks very much. Alan Smith from Bauer.
Thank you, Health Secretary. The North Sound this week spoke with the Aberdeen Asthma and Allergy Foundation, who want all people with asthma to be made a priority when it comes to vaccination. They say that the current approach of only giving priority to those with severe asthma is inconsistent and actually leaves behind a lot of people who have regular attacks. And they also say that the current criteria is pretty vague, and given how quickly a person's condition can change, the information held by health boards can be out of date. Now, I know you're following the JCVI recommendations, but just wondered how you respond to those concerns of inconsistencies when it comes to people with asthma. And just a quick question for the National Clinical Director as well, if I may. We've seen the launch of a campaign today aimed at showing support for the live event supply chain, backed by Mick Jagger and Biffy Clyro. Given the as you say, medium-term picture there about COVID, what would be your current outlook for the return of live events, particularly those with large attendances?
Thanks very much, Alan. Let me say a little bit about both of those, and Jason may want to add. On the point about asthma, as an asthma sufferer myself, I understand very well some of the anxieties that fellow sufferers have around this. But as the Health Secretary, it's my job to pay really close attention to what clinical experts and vaccination experts tell me, which is where the JCVI advice comes from, but also the advice, in addition to that, from our clinical advisors, people like Jason, like the CMO, like our DCMOs, Dr. Steedman and Dr. Caesar. So I understand the anxieties, but it is right that as a politician, I don't override clinical advice. What I do know is that our clinicians and JCVI are constantly looking at the data and the evidence and other evidence that comes their way that is presented to them, not only from the vaccination companies themselves, but other data that comes forward. For example, the study we talked about earlier, to review whether or not they believe at any point that they should change their guidance or amend it in any way. One of the things I announced today was about JCVI guidance that rough sleepers and others should be incorporated and included in the priority groups, and we should get on and be vaccinating those individuals. Now, they do that because they've looked at evidence since they produced their first set of JCVI priority groups. So please don't think that this is done once and never looked at again. It is something that is looked at all the time. And on your second point, I just make the point before we go to Jason that, as Jason said quite rightly on the old firm question, it will be for Cabinet to make a decision about how we move out of our current situation and respond to the entirely understandable requests and propositions from various sectors in society, be that events organisers or hospitality or other parts of the economy. But what we will get from Jason and his colleagues is the public health advice that will help us to make those decisions. Jason.
So quickly on asthma, Alan, it's well rehearsed, and I do understand the tension and the frustration from asthma sufferers. But remember, the vaccination programme is designed around risk of COVID, not risk of asthma. So if you move someone or a batch of people into the priority groups, you have to take somebody out. You have to move somebody down the priority list. We don't have 9 million doses of vaccine. We simply have to make choices. The Joint Committee have helped us make those choices. They have decided who is in the priority group and who isn't. They've also said, vaccinate everybody as quick as you can. Every single asthmatic will be offered a vaccine who's over 18. And that will happen just as quickly as we have vaccine available to us. But the Joint Committee have made those judgments around risk of COVID. The second bit about live events, just to underline what the Cabinet Secretary says, it's far too early to give definitive advice and never mind make the definitive decisions. I'm hopeful that our advice over the next few days leading into Cabinet on Tuesday will begin to show people what that opening up might look like. But as I said earlier, I can predict 3 weeks ahead. I can't even do that with certainty. I certainly can't predict 3 months or 9 months ahead. I would be very hopeful, though, that the autumn would look very different from now.
Thanks, Jason. Jack Foster from Global.
Good afternoon to you both. Given the reaction to events in London this week regarding the disappearance of Sarah Everard, it's hard not to sympathise with calls for vigils in solidarity against male violence against women. I wonder what your message is, though, to those planning to attend Reclaim These Streets vigil outside the Scottish Parliament tomorrow, given, obviously, the ongoing COVID restrictions. And just one more, which is probably more for Professor Leitch. With schools returning for many pupils next week, parents are now very aware of a lack of consistency across Scotland in terms of how that's going to work, anything from 1 hour to a week to full time. If that's changing after Easter, what's going to be different? And are we to expect, for example, that social distancing rules are going to be relaxed in schools to accommodate that? It feels as though something will have to give there.
Thanks very much, Jack. Let me say a few things about the proposed vigils under the overall banner of Reclaim the Streets. I'm 67 years old. For 50 years as a woman, I have lived a life that aims to protect and keep myself safe in a way that no man of my age ever has to do. And I remember the Reclaim the Nights demonstrations. Can't remember how long ago that was, but it was a good couple of decades ago. And I was on those. And if we weren't in the current situation right now, then any public vigil, I would certainly join. But we're not in normal times. And the rules are there for a reason. They're there to protect all of us from a virus that doesn't play by the rules, that as soon as we come together, looks to transmit itself from one of us to the next person, and in doing that also is given significant opportunity to mutate. And right now, we're dealing with a mutation on that virus that is significantly more infectious than the one we were dealing with a year ago. So I will take my own private steps. I will light that candle on Saturday night. I will engage via social media to show my frustration, my anger that women are no longer, still not safe on our streets, still not safe from male violence on our streets at any time of the day, in our public transport, in our open spaces. But I will not join a public vigil because that risks everyone from this virus. So what I'm saying to all of the women who are feeling angry, afraid, upset, I'm right there with you. But please do not have a vigil. Please take the steps that we ask people to do to show how you feel, but not in a public gathering. Don't break the rules. Stick with the rules around protecting yourself and others from COVID. Light the candle, engage in social media. We have not won this argument for decades. There will be opportunities in the months ahead for us to come together and in solidarity with each other and with women who've lost their lives, women who've experienced violence, women who've experienced fear in every part of their everyday living, to show what we feel, but also what we need done. But for now, let's do that in a way that is COVID safe, because that way we protect ourselves and everyone else. Jason.
Schools. We haven't given the post-Easter break advice yet for schools. What we have said is, for now, full schools is not what we think should happen. And the Cabinet took that advice, and that's why the next few weeks will be, unfortunately, particularly for S1 to S3 and S4 to S6, blended. We are very hopeful that post-Easter we'll be able to change that advice. But that will, of course, depend, and it's very predictable, it will depend on incidence. The number of cases in schools follows the number of cases in the community. So community incidence, as it falls, allows schools to come back. Then the decision makers prioritise what they think should come back, and they've prioritised schools, I think quite rightly, for the well-being of those kids. So we will give advice through our Education Recovery Group, which isn't just public health, it's also education, unions, it's others that form that advice to give to the Deputy First Minister, the Education Secretary, to then take to Cabinet.
Thanks very much. Nicole Cassells from Central FM.
Good afternoon, Cabinet Secretary. So we know that routine testing has been rolled out across wider workplaces, but when you have key workers travelling across different council areas to get to work, why do we not have routine COVID testing in all key workplaces for all key workers? And just for Professor Leitch, from today, kids 12 to 17 can return to outdoor non-contact sport and group activities, and they can cross local council areas to do that. You mentioned there that's for mental health, but what about the mental health of those over 17 for those younger adults?
Thanks very much, Nicole. Let me deal with your first question there on testing. So we have now a very extensive asymptomatic testing programme. The testing programme for people with symptoms, those who are watching will it'll be well known to you how that works and what happens there. But there is now a very significant rollout of testing for people who are asymptomatic. So testing of all admissions to our hospitals, testing of frontline health and social care workers, including care at home workers, testing in communities with our partners and local authorities in areas of perhaps particularly high prevalence or in other areas that the local authority identifies. And some of that also will include workplace testing. In addition, we've extended testing into primary care and also into areas where there are concentrations of workers who necessarily cannot work from home, like food processing and food distribution. But we constantly are looking at where else might we undertake asymptomatic testing or offer asymptomatic testing that will add value to the overall objective, which is to bring the virus levels down as low as we possibly can and break chains of transmission. So the other place where testing is undertaken, of course, is testing of close contacts and testing where there is a particular outbreak, and people are familiar with that. The key to so the door is not closed to other workplace testing where there is evidence that that can add value. But testing on its own, and we've said this many times, but it's worth repeating, like vaccination, isn't the single thing that helps us get out of where we are now. All of these, vaccination, testing, compliance, all works when they work together. And one of the important areas of compliance is about the wearing of face coverings when you're on public transport and avoiding car sharing. And I appreciate for many that latter is difficult, but it's important, and employers have a responsibility, I think, to help those in their workforce who cannot work from home, who need to travel to work, to help them to avoid car sharing and to encourage them to comply with face coverings and so on. And remember too, employers also have a legal obligation to support people to work from home unless it is absolutely impossible for that to be undertaken in that way. So we'll continue to look at what more can we do with our testing programme and our approaches. And indeed, in the coming weeks before Parliament stops for the election period, my colleague, the Health Minister, Marie Goujon, will be making a statement in Parliament about everything that we've done and where we plan to go next, using testing as one of the key measures that we have to help us suppress the virus. Jason.
Well, the opening up of contact and non-contact sports, non-contact for all adults over 12, has been a crucial step, I think, in both physical and mental well-being. We have to balance that, though, with the virus. So that's why travel restrictions have stayed principally exactly the same as they were before today. So you are allowed to travel within your local authority for these reasons, and that reason now includes non-contact sport. We've asked you to stay within 5 miles of your local authority boundary, particularly for people who live very urban, so that they can move a little bit to more rural areas. And we've also said specifically that those between 12 and 17 can go to their club if it happens to be in a different local authority. What we mean there is if your scout troop or your Girls Brigade club is just over the border somewhere, if you live in South Lanarkshire and your club meets on the outskirts of Greater Glasgow, then we think you should be able to do that. But we don't want that to increase a huge amount of traffic, car sharing or others. And that's why we have to balance those two things together.
Thanks very much. Neil Pooran from PA.
Thanks, Health Secretary. In terms of the Greater Glasgow area, there seems to have been a relatively high number of cases that you announced today. 276 is, I think, the highest since the 9th of February. Is it possible that this might be linked to the celebrations that we saw in Glasgow last weekend, given the time that's elapsed since then? And are you dealing with any known outbreaks associated with those scenes we saw in Glasgow at the weekend?
So, thanks very much, Neil. It's not possible to answer that in any definitive way. Where we find out where people have been, and therefore where possibly they acquired the virus, although it's not absolute, is when contact tracing is undertaken. So contact tracing will be underway with those cases where, as you know, the individual has a conversation with one of our skilled contact tracers about where have they been, when did the symptoms appear, where were they before that, where were they around that time. Jason can say more in detail around that. Who were they with? What did they do? How long were they there? All of that information comes to us through contact tracing, and that helps us work through not only who might be a close contact, who then needs to be contacted and tested, but also where are we seeing individuals go who then subsequently test positive. So it's too early in the process to make absolute judgments and decisions and form views about where any of those cases might have come from, or how people what they might have been doing when they acquired the virus.
The Cabinet Secretary is absolutely right. You can't tell yet, but people are catching it somewhere. You don't catch it if you don't meet somebody who's got it. So you have to get it from somewhere. I can assure you that Greater Glasgow and Clyde's infection control groups and public health groups will be having problem assessment meetings where we look at that data and we think about what do these data show us about the position, we won't know until the contact tracing is done where people have been. That, of course, doesn't give causation. It just tells you where they have been. And if we see a pattern, then we'll have to give advice around what that pattern tells us.
Thank you very much. Conor Matchett from the Scotsman.
Thank you, Health Secretary. I appreciate your words earlier on the planned Reclaim the Streets vigil, but I wanted to return to it, kind of following on from the question about the Rangers celebrations last week. Will the Scottish Government, or you, or the First Minister, or you, Professor Leitch, be asking the police not to intervene or seek to disperse these gatherings, given the certainty that they will go ahead, and given the police's operational decisions last week in terms of, essentially helping the Rangers fans meet safely rather than dispersing them? And a second question, if I may, as well. Can you guarantee that the speed of the vaccine rollout won't slow down, obviously supplies dependent, as we go down the age groups? There's concerns among young adults, and I'm thinking 18 to 29-year-olds here, who are obviously going to be waiting the longest for vaccines other than children, that as the country gets more and more vaccinated and opens up more and more in the economy, that the political will to vaccinate that age group will disappear.
Okay, thanks very much, Conor. Let me take your last question first, because I actually thought you might have been going somewhere else with that. Political will absolutely not disappear from this government or any future government that comes into being after the elections in May. The political will is absolutely there to vaccinate all adults over the 18 and over. Where we're having a bit of thinking is whether or not the information and the promotional work to encourage people to come forward for vaccination may need to be retailored to suit younger age groups. And we may use more digital, for example, to do that than we did with those in the older age groups. But it is vaccine supplies dependent, and it is always dependent on supply. But as soon as we get supplies, we have the infrastructure, the vaccinators, the sites, the systems to get that vaccine into somebody's arm as quickly as we possibly can. And we have the absolute commitment to do that. So supplies are the only risk-limiting factor that we are dealing with. And we are on track at this point to have offered the vaccine to everyone in the priority groups 1 to 9 by the middle of April, and to have completed and offered vaccine, first dose vaccine, to everyone aged 18 and over by the end of July. Remembering that as we do that, second dose vaccines are in play too, and grow in number, obviously, as we go through that. On your point about the police, the police will take the operational decisions that they think are right to take. And it would be entirely wrong of me or any politician to direct them in any way or ask them to do something in particular in any way. They need to be able to take those operational decisions independently. My focus is on saying to the women who will want to show how they feel, and they might be tempted to do that by that public gathering, what I am saying to all of you is, please don't do that. Please use other means to make your voice heard. Light that candle, use digital means, use other means to make your voice heard. Write to your MSP, write to your MP, get involved in that way. And when the time is right, and by right I mean we have suppressed the virus to sufficiently low levels that public gatherings outside are possible, then we will come together and make sure that our voices are heard. Anything, Jason? No. Rachel Watson from Daily Mail.
Thank you, Health Secretary. I just want to follow up on the point that Conor made on vaccines. The numbers of those who've had a second dose are still relatively small to those who've had their first dose, obviously. But as we go further into this, will the Scottish Government have to prioritise giving people their second dose rather than prioritising getting younger people their first doses, so that we don't go over this 12-week waiting period?
Thanks very much. Rachel, as long as supplies come through in the volumes that we need, and remember this is a four-nation UK issue, so all health secretaries like me across the four nations of the UK are working in the same way. As long as the supplies come through in the volume that we need, then we are able, all our modelling, all our forward projection of numbers, and we know what the numbers are, we know the numbers of people who will become eligible in what week for their second dose to ensure that they are vaccinated within that 12-week period. All that modelling is there. As long as the supplies come forward to allow us to do both, we will do both. And at the moment, we have no reason to expect that we will not have the supplies that allow us to increase the numbers of people coming through for their second dose vaccine. We know what that looks like in the weeks and months ahead, whilst we also prioritise and vaccinate those from the JCVI group, complete that by the middle of April, and then move into the younger age groups, again following JCVI advice. And actually, by the time we have prioritised and vaccinated those first groups 1 to 9, we will have vaccinated a very significant proportion, just over 3 million from memory, although if I'm not quite right about that, we will correct that with you, Rachel, later, but just over 3 million of the adult population of the 4.45 that we said we needed to vaccinate those over aged 18 and over. So by the time we get to the middle of April, we will be well on our way in reaching that 4.45 number, and we will be delivering the second dose as well. And the only limiter on any of that is the supply coming through. And at this point, we have no reason to expect that it won't come through on time.
Sorry, can I just come back on that point? But what if those supplies don't come back? We saw a dip in supply previously. So are there plans, does the government have contingency plans that would see second doses prioritised?
Well, we always have contingency plans for just about everything. And of course, the clinical advice is to make sure that second doses are delivered within the 12-week period. But there is no reason at this point for any government across the UK to believe that supplies will not come forward to allow us to do both. And that's really important. I really don't want the message going to the younger age group that somehow their appointments and their vaccination is in doubt at any point. No, it's not. It's not in doubt at this stage. We have no reason to believe that we will not have the supplies that allow us to do both. And we've got all the planning and all the modelling and all the infrastructure there to allow us to do both, and to do both as quickly as we need to do them. Dan Vivers, from The Sun.
Thank you, Health Secretary. Good afternoon to you both. Just to stick with the theme of the vaccination programme, your vaccine supply and use figures this week show that as of March 8th, there were about 970,000 unused doses from the allocation of 2.9 million so far. Now, your press office confirmed to us yesterday that allocated means available to the Scottish Government for ordering, and that 970,000 figure is more than double the figure when the last supply figures were published on March 1st. And the total supplies allocated up to March 8th are actually similar to what you were expecting at this point, according to the vaccine deployment plan that you had to unpublish back in January. Now, we all know this is a huge and complex task logistically, but given the supplies do seem to be there, could we have moved faster and ramped up the rollout this week?
No, I don't believe we could. And if we could have moved faster, we would have moved faster. And actually, if you look across the delivery schedules and numbers of vaccines delivered across the four nations, you'll see across the four nations that we all experienced that self-same dip. Of course we would, because the supplies come into the four nations as a whole and are then distributed as we've gone through many times. So if we could go faster, we will always go faster. We have demonstrated that we can go significantly faster if supplies are there. But we also have to ensure that the way we use supplies is not only to make sure that second doses are done, but remember the important commitment we made, and that is that the vaccine that you receive in your second dose is the same as you would receive in your first dose. So remember too that on the 8th of December when we started, the only vaccine we had available to us at that point was the Pfizer vaccine. So all the people from the 8th of December right through who are now eligible coming through in a sequence for their second dose, it's the Pfizer vaccine that is being used, because that's the commitment that we made to ensure that people understood what would happen. So we've not gone, why would we go deliberately slowly? Why would we do that? We know the importance of the vaccination programme to individuals and from emerging data, potentially on transmissibility. So we go as fast as we can, and we have all the infrastructure that we need to be able to do that, and we've demonstrated it already in the programme. Georgina Hayes from the Daily Telegraph.
Good afternoon, and my apologies, my camera is broken. The Scottish Government has said that when we return to the level system, that there'll be tighter rules around cases that will be used to decide what areas fall under which level. But given the success of the vaccination programme, will the number of cases become less of a metric in deciding levels? And if not, are you concerned that people will feel hopeless and won't follow the rules if their area is placed in, say, level 3, but they see very few deaths and hospitalisations?
Thanks very much, Georgina. I know that Jason, rightly so, will have a lot to say to explain how the approach will be taken and what the triggers would be, or the data is that governs, if you like, the rules. We are aligning ourselves with the World Health Organization. That makes perfect sense. First Minister has said that already, and she will set that out in more detail on Tuesday. And Jason will explain to us all what those World Health Organization pointers are that we will align ourselves with. I think there is, there is always a real importance in whatever we're doing in being as clear as we possibly can be about the rationale for what we're doing and being very transparent about the data. We publish increasing amounts of data, and we do that very deliberately so that people can see the information that we are using, that people like Jason and others use to give us the clinical advice that we then use to make our judgments on as a government. And I think that that is what has been significant. That and the opportunity to for people to ask questions and for us to answer those questions, and the scrutiny of our Parliament, of course, on everything that we're doing. All of that, I think, is what is important in securing the compliance and the trust, because compliance is based on trust, that we have from people across Scotland. And there aren't words to express how grateful we are for that, because it matters so much. And what we've seen over the past year and more is a significant effort by people across Scotland to abide by the rules and do everything they can to suppress the virus. And that is significant and one of the critical factors as we go forward. So we will take all the steps that we need to take to ensure that people continue to feel that they know what is going on, they understand the reasons, they can see, they might not like some of the decisions, but they can see the sense of them, and they will then comply with them. Jason.
It's a good question, Georgina. So will number of cases become less important in the advice and the decision making? Potentially, but I'm afraid you've jumped ahead of the science. So today, the answer is no. But potentially, in the months to come, the answer may become yes. The WHO tell us to look at 5 things: cases, positivity, hospital admissions, ICU admissions, and deaths. We already know vaccination reduces ICU admissions and deaths. We think it reduces hospitalisations. We don't know if it reduces cases. The early data that the Cabinet Secretary talked about right at the beginning about transmission suggests it might, but we don't know that in the real world at scale. But vaccination is a means to an end. So vaccination coverage is crucial, but only because it leads to less severe disease in those vulnerable communities. So for now, cases is still absolutely crucial because of the risk of hospitalisation and death and the risk of chronic disease, long COVID syndrome. But in the end, as we come through this, you're absolutely right. It may be that higher case numbers are not as important because they're more protected. But the mission for now has to be to get that number down as low as we can possibly get it. The other complication is the higher the cases, the higher your chance of mutation. So if you have more cases, it's no coincidence that the mutations came from the UK when we had high numbers, Brazil when they had high numbers, and South Africa when they had high numbers. So the other reason to get your case rate down is to keep the same virus that you know how to manage.
Thanks very much. Tom Martin from Daily Express.
Hi, thank you, Health Secretary. On Tuesday, in the parliamentary statement, the First Minister announced there'd been a fourth case of the Brazilian variant found. It was related to a passenger coming in through Edinburgh. I just wondered, is there any further update on that? Have there been any more cases identified linked to that or elsewhere at all?
Thanks very much, Tom. I don't have the detail of that particular case with me, but I have not been notified of any more cases of that particular strain of the virus. I don't know if Jason has anything more to add.
Only a little bit. So remember, this was a potential Brazilian variant P1 case. It wasn't a confirmed P1 case. We used new technology for the first time in the Glasgow laboratory to give us a kind of indication that it was the Brazilian variant. We then sent it for genomic testing, which doesn't take hours, it takes days. We haven't had that back yet. But in the meantime, we've done enhanced contact tracing for that presumed case or potential case, and all of that has revealed no further cases that give us any cause for concern.
Thanks very much. Helen McCardle from the Herald.
Hi, afternoon, Cabinet Secretary. I just wanted to follow on from the PHS and Glasgow University study. I wondered if you have any breakdown at the moment within the health and social care workforce of what the vaccine uptake has been, like specifically NHS workers, care home workers, social care workers who are not in care homes. Because I know, for example, in England, there have been some concern about some of those groups having a lower uptake. And just in light of the evidence that's been coming out from Public Health Scotland and the Glasgow University study on transmission, whether or not you would consider making the vaccinations compulsory for these workforce groups. Thank you.
Thanks very much, Helen. Jason will have more to say about the particular study and what that tells us and so on. Just on the percentages that you were looking for, I don't have those with me, but we do publish those and certainly we'll make sure we get them to you later this afternoon. We've had a really high uptake from care home staff and frontline NHS staff and care at home staff. And you'll remember that we did some very specific question and answer webinars for individuals so that they could ask us any questions they wanted. And in fact, Jason took part in those and we saw a significant increase at that point. So we are in high numbers in those, but we'll get the percentages to you. On the point about compulsory or not, we've always said from the outset, I think for very good reasons, that the vaccination programme has to be a voluntary programme. And that is where we still are. That is still our view, that vaccinations should be voluntary. And it is our job as government and the NHS's job as our National Health Service to give people all the information that they need about the benefits of the vaccination programme to encourage their participation. Scotland has a really good track record in vaccination programmes over many years for children and also for adults. And we've built on that. And I think what we've seen so far in the significantly high levels of uptake, higher than we had planned for, our planning presumption was 80% uptake, and it's higher than that. so far across the different cohorts tells us that people are keen to be vaccinated and understand the benefits to them and also to their loved ones. So we'll keep on doing that, but we'll also keep on refining whether or not and reviewing whether or not we need to make any improvements in how we present that information, the different channels that we might use, and also the information, add to the information that we present. Jason?
Not much to add. The numbers are exceptionally high, Helen. The last time I looked, I don't have them with me either, and we'll get you the actual numbers. The last time I looked, healthcare workers was high 90s, and social care workers was around 90, low 90s. Remember, not everybody is eligible, so there will be some people in there for very good reason not having the vaccine, but pretty much everybody who's been offered has come. We did have a little bit of a 2 or 3 weeks where social care workers were a bit low, and we put some targeted interventions in there using their care home organisations to help us with communication into them, and that got the numbers up really high. If anybody is still unsure, they really, really should do that to protect themselves and their family. The study itself is the beginnings of some really interesting data, and it's important for people to realise that Scotland is leading the way on a lot of this research, and it suggests that those in the homes of those vaccinated are not as at risk as those without a vaccinated individual. So that is one of the first studies in the world that suggests transmission is being reduced.
Thanks very much. Jason, Mark McLaughlin from The Times.
Good afternoon. One for Jason. The Times reported today that the two of the highest areas in terms of deaths were Parkhead and Ibrox. Is that just a coincidence, or is that linked to the fact that they've got two of the biggest football stadiums in Scotland in areas of high poverty? How problematic would that be in terms of getting the Euro Championships going again in Hampden, which is on the edge of Govan Hill? Is there maybe a case for having those games in Murrayfield, because there was no similar rise in death around Murrayfield despite the France rugby game this time last year? And how does the vaccine, this new transmission study, play into that? Are you more confident of these matches taking place because we know about the transmission risk being reduced by the vaccine?
Thanks very much, Mark. I'll go to Jason in a minute and just make a couple of points myself. I know Jason will want to respond to you on those numbers that you were talking about. But the starting point, of course, is that all of us want to see the Euros played in Scotland, not least that our national team is, for the first time in a wee while, part of that. And we want to be able to support our national team and cheer them on and see the Euros played here. Where that happens, how it happens, in what circumstances, is for discussions that continue and can't be preempted at this point. It's a wee while away, and it depends on all the factors that everyone watching is very familiar with, about how we're doing with the virus, how the vaccination programme that is going so well so far, what increasing evidence do we see about the impact of that, ensuring that people come forward as we go down the age groups to be vaccinated, and that our test and protect system continues to work really well. So there's a load of factors in there to take account of as we go through the coming weeks to help us in all of that. And then the discussions about, well, where is the best place for those games to be played are part of a discussion with a number of others who have a real interest in hosting the Euros and making sure that they're played safely and played well. And the rest of us will concentrate on willing on our national team to do well.
It may come as a great shock, and maybe fans would like to, but most fans don't live around their stadia. So I think this is much more likely to be about poverty, population density, health inequalities and all the other things we know about, particularly some areas of Glasgow, and we know about infectious disease. It's a neat attempt to link that, but I don't think it makes scientific sense. Remember, when you get your positive test, you get it to your home postcode, not the postcode where you may have caught the virus. So fans are distributed all over the country, all over Glasgow, all over Edinburgh. So I think there is, though, a health inequalities angle and a health inequalities factor involved in people who get COVID and then get severe disease, and we've talked about it here many times. The transmission study doesn't give me particular encouragement about the Euros, but it does give me encouragement about relaxing all the safety measures in time, one of which will be stadium attendance. And I look forward to that being in time, if possible, for the Euros.
Thanks very much. Martin Hannon from the National. Martin, are you there? You're on mute, Martin, apparently.
Oh, right, sorry about that. Good afternoon, Health Secretary, Professor Leitch. My partner, Deb Armstrong, is in the 60 to 64 age group. And yesterday, after seeing things on social media, she called the vaccination helpline to be told that her appointment is actually set for Tuesday. She didn't have the letter. And the woman, very helpful woman who answered the phone, said that they had been inundated, I quote, with similar calls. And of course, the issue was raised on Tuesday by Jackie Bailey and others. The First Minister said that she would look into it. Can you tell us, and this is a real problem happening now, if you go on social media, there are dozens, if not hundreds of people reporting a similar experience, and it would appear that vaccination appointments have been missed. Can you tell us what the scale of this problem is, and how has it happened, and what's your advice to people? Should they just wait for a letter, or if they're in that 60 to 64 age group, should they be calling the vaccination helpline? So
we're working through the 60 to 64 age group. Remember that the group before that, those under 65 and under, who have an underlying health condition and unpaid carers, is a particularly big group. And a group also, as you've heard me say earlier when we started off the briefing, where there is additional work needed to ensure that we can reach everybody, particularly unpaid carers. And we said that that group would take some time to work our way through. And then as we move through it, we are doing, as you quite rightly say, bringing in appointments for those who are 60 to 64. In any big operation like this national programme, there will, from time to time, be glitches in the delivery of letters, sometimes in the issuing of letters. What really matters is that people are being called for their vaccination appointment. And there may be instances where if I call the vaccination helpline today, they would tell me that my appointment is, that I'm booked in. They can see a week ahead or so, and they can tell me my appointment is booked in. And if I'd waited and not made the call today, the letter might have arrived tomorrow. So we always look in some detail at whether or not there are particular system problems. At this point, we've not identified any system problems, but we will continue to look and make sure that the vaccine management tool and the booking system are working well together, and that we're getting that information out to people as quickly as we possibly can. And we constantly are discussing with Royal Mail to make sure that the delivery schedules at their end are working well with us. And they have been really helpful partners in prioritising those blue envelopes. That was the point of the blue envelope, was that it stood out and was easy for Royal Mail to identify. But from time to time, we had a problem in one area of Scotland, and it was around a particular delivery issue. So we always investigate it, and we always try and resolve it if it is a systemic problem, as opposed to it's an incident in one area that you couldn't have foreseen, and there's nothing wrong with the system. So if there is more that we need to do, then we will absolutely make sure that people understand that. In the meantime, what I would say to those in that age group is that I would wait, personally, I would wait maybe into the early part of next week. And if you haven't had your blue envelope, then phone the helpline and see if they can help you in terms of knowing whether or not you've got a booking. And Alasdair Clark from Edinburgh Live.
Thanks, Health Secretary. Just to follow up on the last question there, we've heard from significant numbers, and it really is significant, of people who are in priority group 7 but have received no letter. They phoned and been told that they've got an appointment next week. You're advising them to wait until early next week. These people are being told on the phone that they've got an appointment on Monday, Tuesday morning. Is it not time for the messaging to change on this? There does seem to be a problem and people aren't getting the letter in time. Is it not time to start telling people to phone this helpline and find out, when their appointment is now?
Well, of course, if people are anxious about that, then they absolutely should phone the helpline, and I didn't say anything different. But I've also received a number of communications where somebody is contacting me on Wednesday to say that they've not heard and what should they do and so on, and then only to email me on the Thursday and say, it's okay, I've got my envelope. So there is a degree to which we need to have a level of patience here, all of us, as we work our way through this programme. But of course, if anyone is anxious about this, then they should use the helpline. That's the point of the helpline. And there is also, through NHS Inform, the opportunity to fill in a form if, for example, and this is the case in some instances, where people have moved home or have not yet registered with their GP and they worry that they might get missed altogether, then there is a route through for them to be able to do that by filling in the form. And there's a lot of work underway to make sure that those responses back to individuals happen as quickly as we possibly can. So we're doing a great deal to make sure that the system works as well as it can do, to make improvements as we go. But the helpline and NHS Inform are two routes for you to go down if you've got any particular concerns and anxieties, and you absolutely should use those. That's us for today. Thank you very much to all the journalists who've joined us. Thanks very much to Anna, who's been our BSL interpreter today. My thanks to Jason. But of course, as always, my thanks absolutely to all of you for taking the time and the trouble to join us once again. I don't have words, as I said before, to express my gratitude for everything that you are doing to comply with all the rules and the restrictions, difficult though those are. I hope that the small easings that we've announced today, that happened today, First Minister announced on Tuesday, that come into place today, that you can take advantage of those and they make things feel a little bit better. The signs are promising. We are making significant progress, but gradually, step by step, in a safe, sensible, precautionary way, we will work our way through and out of the current situation that we're all in. And in the meantime, the most important message, notwithstanding the opportunity to meet in 4 adults from 2 households outdoors that can take place from today, the most important rule remains to stay at home. When you do go out, to remember facts, face coverings, avoiding busy places, cleaning hands on hard surfaces, maintaining 2-metre physical distance if you're talking to someone, and isolating and booking a test if you have symptoms. That and taking up the vaccination appointment when it comes to you are the ways by which we make sure, all of us, that we continue to work together to suppress the virus, to bring down those case numbers so that we can take those steps that we're all waiting for to move sensibly and carefully out of the current situation. And it's a way in which, by staying at home, we protect our NHS and we save lives. Thank you so much to everyone who is doing just that. And I very much hope that you have a peaceful and an enjoyable weekend. Thank you.